Well, good afternoon, everyone. I'm going to ask you to take your seats, please. Welcome here on a very snowy Monday. I'm going to start with a quality improvement moment. We issued a report a little while ago which was called Lessons Learned for Co-Designing Events. And one of our lessons was not to hold events in January. I don't lie, that's actually true. So there you go. We're always improving at the Change Foundation. So welcome. My name is Kathy Fuchs. I have the honor of being the president and CEO of the foundation. And we are going to run through a fairly tight agenda today, but we have a lot of, we hope, very interesting things for you to hear about. I would like to start with a land acknowledgement. So we acknowledge the ancestral traditional territories of the Ojibwe, the Anishinaabe, and in particular the Mississaugas of the New Credit, whose territory we are gathering on today. This territory is covered by the Upper Canada Treaties. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions of the Métis, Inuit, and other Indigenous peoples, both in shaping and strengthening this community, our province, and the country as a whole. So again, welcome, and welcome to those of you who are online, who are joining us this afternoon. For those of you who are online, if you are having any issues with the connection or the platform, there's a little chat button that you can click on, and the line is being monitored, so we do have people able to help you if you've got some issues there. I became a caregiver a decade ago when I was looking after an elderly aunt who had a fractured neck. And I was sitting in a hospital room in downtown Toronto, and I did not know what to do. I had worked in the health system for over 30 years, and I was at a loss. So it's one of the reasons that I am so personally committed to the work that we're doing at the Change Foundation, and I'm pretty convinced that almost everybody in this room probably has a very similar story. The foundation began its work with caregivers in 2015, and then we funded our 4 changing care teams in 2017, the work that you're going to hear about today. So it's actually been quite a short journey for us, but we're very proud of what we've been able to do to get here. And that work actually built on work we had done previously, listening to patients about their patient experience. We were very focused on patients, but yet one of the themes that we kept hearing about was how frustrated patients were that their family members or their friends were not being included in care planning, were not being listened to sometimes in conversations. And so even though we were not focused at that point on caregiver experience, we knew we had to come back to it, and therefore did so in 2015. Today, we're very pleased to be able to put a spotlight on the work that we have done over the 3.5 years, all co-designed with caregivers. And we're going to hear directly from caregivers in a video about our wish list. I'm going to talk very briefly about the data that we have released in our Spotlight report, and we're going to showcase the work and the leadership of our Changing Care partnerships. And lastly, we will be unveiling for the first time a suite of tools available for all, for healthcare organizations and providers to help them work more effectively with caregivers, as well as some tools specifically for caregivers themselves. So the Changing Care groups that you're going to hear from this afternoon, we put them through a very arduous process. I think they would say that. We went from 73 applications down to 4, and then we were able to select the 4 after site visits where we could see they had the heart to take on the work that we wanted. And they are Connecting the Dots, which is here on Perth, broad partnership across primary care, home and community and acute care, Embrace, which is Cornwall Hospital's Community Addiction and Mental Health Center, and the Cornwall and District Family Support Group, focused on mental health and addiction in a bilingual community. Improving Care Together, based out of St. Joseph's Healthcare in London, focused on the specialized geriatric population, and Cultivating Care, based in Toronto, as a collaboration between Sinai Health System and Wood Green Community Services. But there are many, many other people involved in these projects, including many family caregivers who really are the inspiration for each. And I'm going to ask all of you in the room, if you can, who are working on a Changing Care team, to please stand up for a minute. Come on, up you come. And we're going to give you a round of applause. And for those of you online, we're waving at you. Okay, so let us start then. We started working with voices of caregivers in a video that we've called the Caregiver Wish List. This is the brainchild of Carol Ann Alloway, who cared for her husband Bill as he had multiple encounters with the healthcare system. We brought together a group of caregivers to talk about what would have made their experience better, and then we created this wish list.
Every year, thousands of Ontarians are thrust into a new and unfamiliar role. This new role can be scary, confusing, and frustrating, and can leave caregivers feeling alone or filled with guilt. When caregivers have a better experience, everyone wins. That's why we worked hand in hand with caregivers from across Ontario to develop this video, the Caregiver Wish List, to help new caregivers feel a little bit less alone in their journey through the healthcare system, and to help give healthcare providers a better sense of what caregivers are going through, and how to help make them feel included as important members of the patient circle of care. Getting admitted into the hospital can be tough for patients, and it can be tough for caregivers too.
I wish that I had gotten a package. I wish that they had told me all of these things. You can park here. We have a special waiting room. The operation will probably be 2 hours. You should wait there, and the doctor will talk to you afterwards, and then you could meet your husband in his room, which will be this.
When a patient arrives at the hospital, sometimes nervous and intimidated, their caregiver is often in the same boat. Recognizing this and treating these caregivers as partners in care is good for caregivers, patients, and healthcare providers. Adding critical information, such as the caregiver name, relationship to the patient, contact details, and maybe even a photo, would help caregivers feel included and valued.
I care for my son Gabriel. He was a premature baby, and at 20 months old he was diagnosed with quadriplegia, cerebral palsy. And my wish list is also to have someone who help us navigate the system, which is very complex.
My husband arrived by ambulance, and my son and I followed in the car. I wanted to know what they were doing to help him, what we should do to help him, who the key players were, and how I could be part of that system. Not just acknowledging me as a caregiver, allowing me to, considering me an integral part of that team.
This involves communication. Medical staff include patients and caregivers in discussions about goals and expectations. New information gets added to a booklet of crucial information for the caregiver. It also gives the opportunity to prepare caregivers for discharge. Does the caregiver have the capacity to meet the patient's needs at home? If not, what training is required?
So I had similar experiences during long hospital stays where I had to learn dressings, I had to learn how to care for a central line, whatever it was. But I had to be able to do those skills before I brought my son home so I could care for him. I haven't found that yet in the adult world.
My mom has dementia, and I felt like when I was there, I couldn't even leave to go to the bathroom. Like, I literally ran to the bathroom, ran back and found her in the hallway, and I was like, okay, you're not that far from your bed.
And on discharge from a healthcare facility, caregivers told us about the importance of receiving a warm handoff. This is when medical staff review next steps, ensure caregiver training is done, and connect the caregiver and patient with support networks.
Last January, my son fractured his hip in a snow machine accident and had to be flown to Thunder Bay for surgery and then flown back to the hospital in Kenora. To have proper discharge planning, to have the steps laid out, like his appointments for physio and follow-up blood work should have been done, should have been set up for him, even if he didn't have a family doctor,
Right. Do an analysis of the household, how you'll be able to move around the household, what things you'll need. Have some counseling for the person taking care of that sick person, and have this all done before they leave the hospital.
Caregivers often feel overwhelmed and most alone once the patient is sent home. At this stage, it's important for continued assessments of the patient's condition and the home care setting to see if caregiver training or resources are needed.
Especially in the beginning, it wasn't really like a break for us because we would be right there and like helping give the shower too, and like it was basically like, okay, now there's this other person and it's basically slower. So like we have one PSW where my sister and I just shower my mom, and then she comes in and feeds her breakfast because that's what works best.
We're so unintegrated, if that's a word, that I have to take photocopies of the discharge papers and mail them to my family physician.
An often overlooked stage of the caregiving journey is what happens when the caregiver technically stops caring for the patient. This can happen for a variety of reasons, including the patient's death or the patient's recovery.
So she's always on my mind when the phone rings, is it the home, did something happen? I'm grieving, I'm waiting for her to die. I have all these emotions around that, and there just seems to be the sense that once they're in there, the family is done. There's nothing more for them, there's no more support, there's no more communication. So that sense that, they're cared for, so you're checked off the list. I'm still a caregiver.
Depending on the patient outcome, various resources can be offered to caregivers, including grief counseling, connection to support networks, or even skills training to re-enter the workforce.
I need someone to talk to, and obviously I couldn't talk to my husband. So I found that tremendously helpful.
I believe in support groups. I attend a support group. Now I go every week. It's so important to connect with other caregivers because we can really share, cry together, we laugh together, and it's been a lifesaver for me. Thanks.
Together, we can support patient care and improve outcomes for all. For more information about the Caregiver Wish List, visit changefoundation.ca.
So hopefully that resonated for you. Lots of issues in there to unpack, and you'll hear more about how the teams are doing that in a minute. Before I get to them, though, I do want to just spend a minute on a report that we released a little while ago called Spotlight on Caregivers, and it is the first ever survey of its kind in Ontario. We had 800 participants from across the province where we did a deep dive into their caregiving experience in the health system itself. And it was supplemented by an online standing panel of caregivers who looked at the information and interpreted it for us, which is moderated by Carol Ann Alloway, the woman I mentioned earlier. So here's some of the things we heard. Many caregivers don't actually self-identify as caregivers, not a term doesn't resonate with them, so they don't see themselves in that role. They see themselves as a spouse or a sibling or a parent looking after a family member. Those that were caregiving often hesitate to admit they're struggling. They're not the person who has the illness or the condition, and therefore they don't necessarily feel they should be taking, quote, quote, attention away from the patient. Depending on where caregivers live, who they're caring for, their other life responsibilities, and the intensity and the length of the caregiving, it can vary dramatically across situations. Caregivers believe that their family member would not receive the same level of care and support if they weren't actually there. And interestingly, when they are themselves looking for information, they turn to the internet and their friends and their family before they look to the healthcare system. So just over half of them reported that the transition from hospital to home in particular was very difficult. Just over half of them were given some information by a healthcare organization or a healthcare professional on emotional support for their family member, and less than half were given information to help support themselves emotionally. And there are the numbers on where people go when they're looking for sources of information. And financial impact for at least 22% of them, where people were facing some real difficulties in terms of having to quit employment or having to go into debt in order to be able to care for a loved one. As well as this work, we also worked with the 4 teams to create a common evaluation and measurement framework so that we would have some baseline metrics that were similar across the teams. These are the groups that helped us put that framework together, and we did a number of activities, including scanning existing surveys, looking at literature, drafting our own caregiver survey, drafting our own provider survey, so that the groups would have data at the beginning of their work. And again, all of this was done with just co-designed with caregivers. We also were able to create an opportunity for the teams to create their own specific questions if they had things they wanted to measure that the other groups didn't. And you'll hear about those results when the teams get up to present. So just in terms of the impact it had, both on the caregivers and the staff, the actual process of trying to create the survey and come up with the questions actually changed their perspectives and the way in which that they viewed their relationships with caregivers. So in terms of the actual teams, I'm going to introduce everybody all at once. The speakers are sitting in the front row here, and then so that I don't have to get up 27 times, they're just going to flow across the presentations. So from Connecting the Dots, we have Ann Campbell, who is a VP Partnerships and Chief Nursing Executive from Huron-Perth Healthcare Alliance, and Monique Hancock, who is the Executive Director of the Star Family Health Team. From Embrace, we have Christine Penny, who is VP Community Programs at Cornwall Community Hospital. From Improving Care Together, we have Roy Butler, who is VP Patient Care and Risk Management at St. Joe's Healthcare in London. And from Cultivating Change, we have Ashnor Rahim, who is a VP Community Care at Wood Green Community Services, and Jennifer Ridgway, who is the project manager for the actual project. So without further ado, I will ask Anne and Monique to come up.
Video first? Okay. I believe we were told the video comes first. Okay, could you start the video, please?
In the past, many people were cared for in hospital and not at home. Recently, we really have tried to strengthen the programs that allow patients to be cared for at home by their loved ones and caregivers. But we didn't quite get the aspect of caring for the caregivers at the same time. So now we're just catching up and realizing how important caregiver health is, as well as the patient's health.
Pauline Linton. I'm a registered nurse. I've been a registered nurse for 34 years, most of it here working at the Seaforth Community Hospital for the Huron-Perth Healthcare Alliance. They feel very frustrated with having to repeat the same information. It's like a patchwork quilt. It's all about their one loved one, their one patient, their one person, but lots of times having different healthcare providers give them different facts. And trying to piece it all together.
Never thought of myself as being a caregiver, never, ever. Sometimes you wonder, does anybody see you? I'm tired. I am tired. I didn't know I was tired, but I am tired.
I think it's really important, number one, to reinforce best healthcare that we can provide only happens when you work with your partners in the system. And through this Connecting the Dots initiative, we have 2 family health teams that we're working with, Star Family Health Team and North Perth Family Health Team. We're working with One Care, Home and Community Support Services, the Local Health Integration Network, and Alzheimer's of Perth. We recognize that if we really wanted to ensure that caregivers were understanding the system as well as they could and being able to connect in appropriately, that we all had to come to the table. We see a lot of different patients and clients, and because of that mix of skill sets and focus, we're really able to make sure this project touches on all the right points.
I'm Megan Ryan. I work at One Care. We actually set up clients for services, so whether that be Meals on Wheels or transportation or caregiver supports, we're kind of the hub for the intakes for Huron and Perth. I'm using the time to talk. I use my lanyard specifically, use the questions that are listed to ask the caregivers how they're feeling, get them talking, get them expressing, if they could use any help. So by asking them, how are you feeling? What if we set you up for a meal program? Would that take some of the burden off you?
I think for me, it's made my practice much more rewarding. I definitely think it's opened the door for my caregiver patients to approach me and to seek help. It's really opened my eyes that a simple question given in a sincere manner can make a world of difference.
I feel lighter. I have gotten it out. I've said it. It just was freedom. Somebody listened to me. I felt there was a big burden lifted off of me.
It's really nice to have a resource to give them, something that speaks to self-care and speaks to their role and what they're doing. The staff are realizing that, everything about nursing isn't about saving a life, but it might be changing a life. Almost every single patient has a caregiver. It's just looking at something a little bit differently.
By investing a few moments in the patient's appointment or encouraging the caregiver to have their own appointment with you to discuss how they're doing, there are so many benefits that make it really worth the time.
Yeah. And as you can see from the slide, we are a team of the Huron-Perth Healthcare Alliance, Alzheimer's Society in Perth, North Perth Family Health Team, the Star Family Health Team, and OneCare, and the Southwestland Home and Community Care. And together, we're really pleased to be able to provide you with some great information of the work that we've been able to do as a result of being members of this great project by the Change Foundation. So thank you for asking us to come. And what we did was we had about 5 weeks of 36 engagement sessions across Huron and Perth, and as a result, we were able to hear from 121 caregivers, 130 providers, and 28 physicians. That really gave us a good perspective of what was happening out there. It told us that what we were learning from the work the Change Foundation had done, it was real. And as you heard from earlier slides, the caregivers don't see themselves as caregivers. You're a daughter, you're a mother, you're a niece, a nephew, a grandchild. I'm a caregiver. And so it was really helpful to identify that they had something that they needed to identify with. And also, it was really an important part for us to start. And also the care providers don't always know who the caregiver is. They know perhaps who the power of attorney is or who the next of kin that's listed, but they don't really know who the true caregiver is. And this, what we're going to talk to you about today, helps us get a better perspective on who is the caregiver and how we can interact better. And we knew that because of this information that it was an important starting point for our project. And now I'd like Monique can tell you a little more about the tool.
Okay, so I'm going to build on what Anne was talking about and really speak about the how right now. So caregivers and healthcare providers came together and we did co-design work and tried to find solutions for the engagement, feedback from the engagement sessions that we had. Important that we had equal voices around the table for this, which was quite unique for a lot of our providers. So how we put it together was the provider members were actually carefully selected from each one of the 6 organizations. And this is really essential for buy-in and getting your peers to buy into the work that we're doing. I remember we were at a quality meeting and we were working on our priorities and trying to figure out what we want to do for the year. And connecting the dots came up as one of our discussion points. And one of the lead physicians leaned over to me and said, "Isn't that the project that Dr. Heiss is sitting on, that Zoe's sitting on, that George is sitting on, Tanya, Heidi, all these members that we know?" And I speak to them because they're our members, they're our people, and we're like tribes in a way, and we support each other in the work that we're doing. And so this initiative really got off the ground at our family health team. And I think what I want to emphasize here is ambassadors, how much they're a key success factor to spreading this across partner organization. The other thing that I want to talk about is infrastructure. So we're going to have a little fun here. I want to ask you how many people know what that visual is on the screen up there. Okay, not bad, about 50%. So it's a game called Kerplunk. And we thought it was a really good visual for our day-to-day our project, in the sense that if you, it's a strategy game, in case some of you don't know what this is. And the strategy is to not let the marbles fall, right? But when you pull out the sticks. So what you can imagine is the sticks are our infrastructure or our partner organizations, right? And the marbles are like our caregivers. And not all sticks are created equal, just like not all supports are created equal. And we actually have to work collaboratively to figure out which sticks will actually make the marbles fall down or have the marbles fall down and which ones don't. So which leads us to our Time to Talk toolkit. So we're quite excited about this toolkit, and I'm sure you'll hear more about this coming up. But our Time to Talk toolkit is really about caregivers and healthcare providers having time to talk. So this toolkit was created to address the needs for increased awareness and recognition for both caregivers and providers. It had posters and pamphlets and meaningful 7 tips for providers. It had e-learning videos, which you saw segments of it from our video there, ambassador and leader guides that we've spread out to all our partner organizations. So Time to Talk was first piloted at the Star Family Health Team, and we did it there primarily because primary care has a very strong relationship with patients and caregivers. We had Time to Talk lunch and learns across each of our sites, and they were very successful because we had co-design team members sitting at these as well as caregivers, and they told their stories. And I remember one of the co-design team members standing up and saying, you know, I thought that I really was doing a good job in caring and looking after the caregivers, but I realized through this work that he's done that it's not so much a huge change, it's just a tweak. It's a refocus that needs to happen during the conversations with caregivers that he mentioned. So we're excited to give some early results right now. We've done baseline and follow-up data at our family health team, and they're very positive, especially in the areas of how they're doing, having caregivers being seen as a source of knowledge, better supports, all showing fairly big increases there. We actually had a steering committee meeting in the December, and we were talking about what does success look like. And I remember thinking back to a site manager that came up to me and said, thank you. You know, we did this survey, and the site manager came right up to us and said, we're going to implement these changes right away. They read it and implemented it right away, which really speaks to collaboration that we're doing. So we're continuing to measure, and we're spreading this across all our partner organizations as well.
So very quickly, what we learned was some pretty outstanding results, so we're quite excited about them. So Time to Talk empowers collaborative caring for our providers, for our caregivers. They get more recognition and validation of their role. There's empowerment to be an advocate because they're armed with more information. We make them comfortable in the system. It opens the door for them to ask help because we've identified them and we've reached out to them. And they're inspired to help others in their journey. So it's amazing to watch all of our caregivers mingling and trying to help other people to say, you've got to learn about this. This is really going to help you. Time to Talk also empowers collaborative caring for our providers as well. So they are really excited, as you saw from both Erin Heiss and also from Pauline there. And so they get a much better understanding of caregiver challenges because the toolkit, which you are going to see many pictures of, the toolkit actually opens that door to have a more meaningful conversation with them. And then it increases the provider's satisfaction because they're actually able to give them some resources. And the resources are listed in the toolkit. The different ways that they can engage with our caregivers are in the pamphlet, and it increases their awareness more so because they always kind of handed that off to other people, but now there's a much greater awareness that they can use this toolkit to say this is who you can call. And then it supports health and safety of our patients because this truly does empower both the caregiver and the provider to have a much better transition home. It's more safe and far more quality of care. So thank you.
Thank you. Can you introduce the next person?
So I'd like to ask Christine Penny to come up, please.
Well, it's certainly my honor to be here tonight representing the work that's going on with our Embrace project in Cornwall. I think that one of the things that I wanted to highlight was the fact that we are looking at as a specific subsection of caregivers. We're looking specifically at caregivers of those who have either an addiction and or a mental illness. So it's a group of caregivers that we felt very committed to providing some support. There are additional stresses that caregivers of this particular group of patients are experiencing. And I think right from the very beginning, our project has been working incredibly closely with our caregivers. In particular, we're very honored that both James Joyce and Marilyn McCauley are here with us as a group of caregivers. It's through the work that they've done through the Cornwall and District Family Support Group that really we were able to get off the ground and recognize many of the things that were spoken about earlier in the video. So we can start our video.
I have been a caregiver for both family members with physical diseases and also with a mental illness. I felt very alone and isolated when we started our journey as a family into the mental health and addiction system. It changes everything. I have been part of the Cornwall and District Family Support Group since 2006. As a caregiver, I wasn't used to working in a hospital, so I had to learn my way around all the hospital systems.
I worked at the Cornwall Hospital since I graduated at the age of 35 as a nurse, and mostly in psychiatry for all that time. I think caregivers felt that they weren't heard, and it wasn't recognized that they were really part of the patient's life, and they were the most important part. We were just there for a little while. They're there for the long haul, right?
There's a number of caregivers in the community who have moved beyond their personal story and do want to get involved in advocating for system changes, and we just brought them all together and co-designed the solutions.
It begins with awareness, and I have to say that in our journey, that's where we started. It was really to bring our frontline providers to the point where they could really appreciate the impact that the caregivers can have on the delivery of service to our clients in need.
A lot of our work has been done on the inpatient mental health unit. We're now identifying caregivers with a caregiver ID badge. There's new discharge planning. We have a discharge checklist for caregivers. We give out a welcome package. There's a mental health caregiver guide in that welcome package that has all kinds of self-care tips. It's very important. The journey is very long with a loved one, and that self-care piece is very important.
I think that we can bring that education, awareness to other providers across the system, and we've been fortunate to have support both from our local partner and the Change Foundation to be able to build solutions.
They want to know that it's okay for them to be there and to ask these questions, and they just need a little encouragement to do that. I'm very happy to see this implemented in a formal way. Did we really value and include the caregiver back then? No, we didn't. And now they're more right in there. They're almost stuck to the patient and caregiver throughout the whole process, which I think is a really great thing.
We're getting feedback from the caregivers, and that feedback is getting better and better. They're feeling appreciated, they're feeling supported.
So when we started our project, we felt it was very important, and I'm sure that most other projects had the same feeling. I certainly know that Anne spoke to this. We did a discovery phase, and during that phase, we actually contacted 500 individuals, and we did everything from one-on-one interviews, focus groups, and some surveys. So over 200 of the folks that were actually part of that were caregivers. The other 300 were healthcare providers that worked within the sector of addiction and mental health. And during that process, we really learned there was such a depth of information there. What we figured, we did a lot of analysis, and at the end of it, we actually were able to develop a caregiver-friendly framework. We found out that there were actually 5 separate project streams that we wanted to address. So today, in my short 5 minutes, I am going to just touch very, very briefly on 2 of the solutions that we developed for both privacy and consent legislation to help caregivers and providers work together around that legislation, and also talk to you a little bit about what we did for discharge planning. So privacy and consent legislation, those of you that work in healthcare know that this is always a touchy subject. And if you think about it in addiction and mental health, it's even more of a touchy subject because of the sensitivity of the information. We found, and we actually heard from our caregivers, that they feel that they are often left out of the discussions because providers are feeling that they're not really sure what they can say, what they can't say. And sometimes by virtue of the illness itself, individuals may be experiencing symptoms that make it even more problematic for them to want to give information to their loved ones. So what we did, we felt that we know that we need to develop some tools to help people feel more comfortable. So the Change Foundation had put together some documentation around this. We built upon that and we developed a question and answer a joint document that actually is containing all kinds of very practical questions and answers that provide a perspective. It allows the caregiver and the health service provider to see the perspective that the other person may be coming from. So the other thing that we recognized is that often when somebody's very ill, they may have one perspective on sharing information with their caregivers, but when they get a little bit better, they may feel differently. So we're talking about this as not a one-time ask, can I, on admission, may I share information with your mother? It may be every day saying, you know, and not pushing, but just a slight nuance. And we felt that it was really, really important for providers to be given some direct practical advice on how they might do that. So, you know, you weren't feeling very well when you came in, yet, you know, you've gotten a lot better. How would you feel about sharing such and such information? Or what information are you comfortable in sharing? So it's around how you have that conversation. And because a client says they'll share information, they don't necessarily need to share everything. So that it warrants a further, deeper discussion. And so we're providing some support to our providers on how they can best do that. Another thing that we really found, well, of course, we all know, and everybody in this room knows that, you know, caregiver involvement is key, really, to the stabilization and recovery of a patient. And I think this is particularly true in our world. And Marilyn alluded to that earlier in the video, that it is a long road for many of our caregivers. It's not a one-off admission. It's a chronic illness, and this is something that we need to be taking in mind when we're dealing with the situation. So we developed, we have an implementation guide for anybody that's interested in having a look at that, and that'll be posted on the website as part of their toolkit. And we also thought, you know, caregivers are in the hospital. Most of this is being done on our inpatient mental health unit. They're in the hospital for a long time. This booklet will allow them to think about the different things that they may need to ask in planning for discharge. So it's quite a comprehensive booklet, and it really is getting at the meat of the matter. How prepared do you feel to take your loved one home? So that's an excellent document. When we started this project, we did not include a project stream around young carers. So here we're referring to individuals who are 25 and younger who may be caring for somebody in their home. Maybe it's a mom, maybe it's a sibling that has an addiction or mental health issue. Many of us know people like that are really providing a lot of support in those situations. So the more we worked and with this project, the more we realized that was something that we really, really felt strongly about. So one of the things that we've done is we've created a young carer advisory committee, And we are looking specifically for young people that we can help feel supported and to contribute to this field. One of the things that was mentioned earlier in a video was caregivers don't know they're caregivers. So this tool here really helps young people understand and be able to decide, am I a caregiver? It's a wonderful tool. The thing about young people, you realize how old you are when they use words you don't understand. Zine is one of them, and this is a zine, and it was developed by our young caregiver advisory group. It's really cool. So if you want to have a look, we brought lots of copies of that. And finally, just to touch briefly on our survey results, these were baseline surveys done at the very, we were a little bit in because we had done some family inclusion work early on. So we see here, and it echoes what Kathy had said earlier, like 36% of the caregivers really felt that they weren't being always offered supportive materials or information. So we're really hoping to change that and make an impact on that by the end of our project. So that's a very high level overview, and certainly we're going to be around this evening and tomorrow. So if you have any questions, feel free to approach us. Thank you. And next up is Roy Butler.
Thank you. I'm Roy Butler, and I'm one of the executive sponsors for this work at St. Joseph's Healthcare, along with my colleague who's in the audience today, Karen Perkin. And on behalf of the team, it's my honor to share a bit of a summary of the work that we're doing at St. Joseph's Healthcare London. I'm going to start off with the video, so if we can roll that first, please.
Our vision at St. Joe's is to earn complete confidence in the care we provide. If you are an older caregiver, how you earn complete confidence may be different than if you're a 25-year-old spouse of somebody with a spinal cord injury. We need to consider the individual person in this journey. It can't just be one solution for every population. In our last strategic plan, we clearly defined the responsibility that we have to create a framework for patient partnership. We work together with our patient council. We've engaged them in lots of initiatives, from how we communicate with them, to the design of our new palliative care unit, to the design of the cafeteria, and then this initiative, Improving Care Together, where we really paid attention to our family caregivers, has really been very complementary and integrated. I think one of the most important benefits is how the project has been structured, really in a co-design model.
With the binder, it actually originated from a co-design event that we held last January.
When staff and physicians started the journey of co-design, what they quickly came to realize is that they had common goals and they had common priorities. What they want is the best outcomes for the people we serve and the best experience for the people we serve.
Tools vary depending on the care area that the binder is being implemented in. We trialed the care binders on a small number of patients and families at Parkwood Institute in the geriatric, inpatient, and outpatient settings.
We had a wonderful letter from our patient and family council in mental health, talking to the changes that they've seen in the organization, how they feel their voice is valued.
I've been a caregiver most of my adult life. What I found as a caregiver at Parkwood was that the inclusion as a partner in care was there right from the first day. It's the first time I've seen a real commitment to the family part of that.
We had a foundation of working together with our patients. Bringing the caregiver voice to the table has been really an important addition to that, but it's built on a foundation of trust and it's built on a foundation of collaboration. So we've started the conversation, how do we now make this an embedded part of who we are? We will build on what we've learned in one program and we will translate that to the needs of the caregiver in another program.
So at St. Joseph's Healthcare in London, we are a Catholic academic teaching organization. We're actually physically located on 5 different sites, and we serve a wide range of patient populations, from acute ambulatory care, urgent care, rehab, complex care, palliative care. We have 130 people that call Parkwood home who are veterans. We have a long-term care facility, and we do tertiary mental health and forensic psychiatry. We, on a bed perspective, have about 1,000 beds across those 5 sites, and we do well over 500,000 outpatient visits. And we have about 4,000 staff, about 1,000 physicians. So the reason I mention that is that our scope is really to learn how we live the principles of this across the organization, and what that looks like in terms of partnering with a family caregiver will look different with those various patient populations. So we're started in specialized geriatric services and are now spreading it across other parts of the organization. Jillian mentioned about 4 years ago, we were redoing our strategic plan. And we were looking at our metrics, and we were doing fairly well overall from a quality and clinical quality perspective, from a patient satisfaction perspective. And we'd just been accredited with exemplary standing, second time back to back. So as Jillian reminds us to be humble servant leaders, we were still feeling pretty good about ourselves. And then sort of pushed ourselves to say, well, what aren't we doing well right now? And really felt like we weren't partnering with family caregivers and patients' residents as well as we could have been. So put that front and center in our strategic plan 4 years ago. Then we built this framework to kind of help guide us or think about that work and communicate the work we're doing. So obviously the patient and resident still front and center, but you can see the family caregiver fully in that circle. And then how do we partner in terms of both direct care, improvements in care, and advocacy for care. And along the bottom, challenging ourselves to move from left to right. So less inform, consult, and how do we move towards more to co-design and empower. When we went out and did our discovery phase and our initial co-design events, really 3 main themes came through that were similar to what you saw in the very first video today. Was involve me, educate me, and please help me with transitions. Whether it's in your organization or out of your organization, please help support me as a family caregiver differently through those transitions. So one of the first things around that involved me was how do we make that kind of live in the fabric of the organization day to day? And the power of just that individual greeting and that interaction on a daily basis. This is Sandy Kaplan, who you saw in the video, her husband Paul, who she is a caregiver for. I'm going to roll the video just to hear in Sandy's words the power of that greeting.
When you are a support person, you need support. If you're going to shine your light in the world, you have to fill up your lamp. And the only way to really do that is to have the support of others and the encouragement of others. For me, the support came in everybody's greeting, including me in the how are you today? A hello can bring a smile as quickly as anything else. And when you get a smile too, with an energetic staff person, you just feel as if you've walked into a hug.
So one of the things we've been talking about is sort of key words at key times. So if I'm a care provider walking into, and Sandy is there with her husband Paul, and I look at Sandy and say, hi Sandy, I'm Roy. I'm going to be your registered nurse for Paul today. I'm going to be here to 7 p.m. I've worked on this unit for 12 years. If you have any questions about anything that's happening with Paul today, feel free to ask me about it. And while we've got a second, how are you doing? Is there anything I can do for you right now? The power of that 10 seconds, it instills confidence. In this case, inappropriately so, because I'm not a nurse, but it instills confidence. It helps to reduce anxiety for that person, and it welcomes them into the circle of the conversation of care about Paul. We heard a little bit in our video that through one of our co-design events in specialized geriatric services, kind of that theme of involve me, educate me, and around the transitions came through. One of our initiatives was the implementation of, we call it our care binder. I keep saying we need to find a new name for that, but the care binder. And it's sort of the one stop that family caregivers said they want to have a go-to place. Describing the roles of everybody who's going to see my family member, where do I reach them, discharge checklist about what do I need to be educated about before I go. Thank you, 2-minute warning. And I laughed when I saw at the beginning of the video about the, parking. Well, in the binder, we've got, where's Tim Hortons and where do I park, right? So some of the key kind of 101 stuff that the family caregivers want and need. So in specialized geriatric services, where we implemented several initiatives, we collected that baseline data, kind of post-implementation, did another survey on follow-up information, and you can see some of the results here. About 15% increase in caregivers saying, they were usually or always asked about how they were doing. Always, top box, always being treated with respect and courtesy. We were at 83%, but then we increased that by 10%. We were at 93% post. And more modest, I would say, improvements in our provider surveys in terms of understanding role and engaging family caregivers. So I would say more work to do on that side as well. And finally, looking at kind of using the power of that family caregiver voice and some of the system change we're doing. So at St. Joseph's Healthcare, we're providing leadership across the Southwest Local Health Integration Network to look at how we can provide care to seniors who are frail in a better way, working with multiple community partners. In that work now, hundreds of family caregiver voices, not just on our steering committee, but at events that are saying, what's the current state really look like? What's your future state want to look like? And what ideas do you have about locally? How can we do things differently here? And so we're embedding that in some of our strategic work. We also established a community advisory group about a year ago, have VON, home and community care, Meals on Wheels, several community partners that we are sharing with. What are we learning? What tools are we using about our tools and processes? But also in that transition piece, how do we work together differently as we continue to go forward? So we have lots of work to do. We're looking forward to learning from our partners. And we want to thank Kathy and your team and Harpreet, who supports us, for the opportunity you've given us to accelerate this work on our organization and for your vision and investment in improving the system of care with and for those we serve. So I'm now going to turn it over to Ashner and Jennifer to talk about cultivating change.
Sucks going last. So thank you so much. We're so excited to be here, Jennifer and I. We'd like to start with the video, please.
Being urban, some things are easier. You can get to places more efficiently. There are systems available in terms of transportation. Things are easier to reach when you're urban. There are real challenges of an urban population compared to a smaller suburban or even rural area. Part is social isolation. Our clinical partner in this is Woodgreen. Woodgreen is a home service, a community social services agency, all throughout Toronto, but very much in the east end of the city where we are. We're trying to make, starting with Bridgepoint, but certainly the whole system, caregiver friendly.
What I've been noticing sort of in terms of engaging caregivers right now and some of the things that we're trialing out is maybe that they don't see themselves as a caregiver, or maybe they don't see themselves, they don't use that word, for instance. So sometimes the language kind of gets in the way. Sometimes people haven't thought about the work that, they're like, well, that's my husband or my wife or my partner. I would be doing this no matter what. It doesn't matter kind of what label you put on me. It, I think, highlights that families and caregivers and patients don't necessarily have all the education they need, maybe about their role or about the health conditions or about the system that they're kind of finding themselves floating through a little bit. We're trying to put together a support group for caregivers that's part peer support and sort of community building, but also part psychotherapeutic.
I think there was more programs at the center for him, but I think as his ability lessened, it was easier for him to come here and enjoy it. What I benefited from, it has given me this great ability to enjoy one of my favorite pastimes, sports I love, is lawn bowling, and also I have the opportunity to play cards. which I'm very keen about. My personal life has changed.
It is more than just it being a nice environment for caregivers. It is more fundamentally bringing caregivers into the circle of care, training them, supporting them, and not dismissing them at the end of discharge, but handing off not just the patient at the end of hospitalization, but the caregiver into the community as well. This type of partnership between an agency that's based in the community and a hospital is the way forward. You can be stunned when you sit in a caregiver room and understand what their priorities are, what they value, and what's needed. They're ideas you never come up with on your own. Partnership concept is crucial to the success of this and is our future.
So thank you for that. So Wood Green and Bridgepoint serve many of the same clients. We share a community, and most importantly, we are part of an integrated system of care. This means that we have a responsibility to our patients and clients, and specifically to our caregivers, so that they can feel confident that they won't fall into a chasm when they leave the hospital and go back into the community, or that the life they lead in the community won't be lost when their loved one is in the hospital or returning to the community from the hospital. As providers of healthcare, this project really allows us to plan together with our partners at Bridgepoint, but more specifically with our partners, the caregivers, to improve how and what type of services we provide in our organizations, but also to challenge ourselves to think about what does an integrated system of care mean from a caregiver's perspective. In June of this past year, Wood Green held a hugely successful caregiver summit. Over 100 people, providers from across the system, and more importantly, a diverse range of caregivers, came together for a day of honest and sometimes very difficult discussion. The question on the table was, what are the 3 top change ideas that community agencies like Wood Green could implement that would result in better support for our caregivers? And boy, did we hear from them. The caregivers told us, first of all, give me more control over the respite services you provide me. If it's my service, why are you telling me how I have to use it? Treat me as an equal partner. Recognize my role as the caregiver and make sure that I have a say in the care provided. And finally, help me connect with others and that understand my experience and help me make myself a priority. This was very interesting because we expected this from a lot of our seniors population, but where we heard it loud and clear as well was with our parents of children with developmental disabilities, who explained how often they feel lonely and isolated, and asked how we could introduce them to other caregivers and create positive supportive space for them to meet, and how we could better design our programs so that one of the outcomes of the program was to help caregivers, in this case parents, find time for themselves to help them practice self-care. Well, the first thing we did was change our respite policy to ensure that the services we provided mattered and were directed and selected by the caregivers themselves. In order to do this, we had to change our intake and assessment process to ensure that we actually asked the caregivers about what they needed instead of assuming that we already knew. We're working to enhance our staff training so caregivers can be confident that the workers that come into their home will be able to manage whatever care situations arise. And finally, we've worked with our caregivers in specific programs, like the Parent Outreach Program, or POP, so parents can come together in a meaningful way and help each other. This year, at our POP holiday party, for the first time, we held a celebration of caregivers. Thanks to the Wood Green Foundation, we provided beautiful self-care gifts to all our parents as a way to recognize and celebrate them. These are just a few of the examples that we've started to work on thanks to the funding from the Change Foundation. We're excited about our ongoing partnership with Sinai and, more importantly, with our caregiver group, and are confident that together we can build an integrated health system that values and honors the important role that caregivers play every day. Now I'm going to hand it over to Jen.
Thank you, Ashnor. So we're going to, I know that we don't have a lot of time, so we're just going to kind of touch on our family presence policy that was part of our quality improvement plan. But this was actually an excellent opportunity to roll out the caregiver ID at the same time, which added utility to the caregiver ID because it was connected to access. So on June 5th, we rolled out the family presence policy across the entire Bridgepoint site, which means we didn't do any kind of a pilot or a phase rollout. It was like a light switch. We flicked it and we no longer had visiting hours. So there's no longer an announcement at 8 o'clock saying that visiting hours are over. People are welcome to visit who they support anytime it's convenient to them. We have something called quiet hours. So from 10 p.m. in the evening until 7 a.m., everyone, including staff, are asked to put their phones on silent. They're asked to speak in hushed tones and really be respectful of those who are trying to get the rest they need for recovery. So this is just a visual, which is part of the change. And we have two examples of a caregiver ID badge. The first badge, which just has the location, is for our shorter term caregivers. So someone who's providing support to a patient for less than 3 months. Someone who's providing long-term care has the same badge but has a photo, just like staff badges. So this is for our more complex continuing care units where we have patients who often are there for years because they're too complex to be serviced in the community. And with the badges, the reason why they have the location on them is that our elevators stop working at 10 o'clock in the evening, and the unit that you're providing support to someone is the only unit that the caregiver badge will allow you access to. So we heard loud and clear from providers, especially nursing staff in the evening, that they were concerned about people being able to be throughout the hospital. But this allows the caregiver to only go to the unit that they're visiting someone on. So that was helpful in those discussions that we had in engagement with staff. So this is Nadira here, and Nadira is a nurse who works on our acquired brain injury unit, and she let us know that she was really concerned initially about the safety of staff and families in the evening. She was concerned that there might be interference with care provided, and that the family presence policy, with family presence, caregivers are more involved, she found, and they share valuable information. So she feels she's actually able to provide better care now that she has those interactions with caregivers. And then we have Stephen, who's supporting his wife who's in our complex continuing care. So Stephen has the example with his photo, and Stephen is saying that I'll now be able to do some of my own errands, so taking care of himself, that's self-care, and then come in for a visit without having to ask permission. So before the family presence policy, some caregivers could ask permission to be on the unit, but now we have an open policy to welcome everybody. And this is just an example about how we can eliminate a barrier and be more flexible in partnering with our caregivers. So we've done the baseline surveys for the stroke unit, and we can share them up here. And the one thing that we found most often commented on was that providers felt that they didn't have the knowledge to, that they didn't have the knowledge to share with caregivers about community resources and transitioning. So that's just the baseline. We're going to soon resurvey and see how far we've come. The neonatal intensive care has also rolled out their survey for baseline. The community surveys have been administered, and the palliative care is going to begin in March. So we're out of time, so I'm going to hand it back to Kathy. Thank you.
So thank you to all of you who were able to speak and stick to the 5 minutes. We know that was really tight. I hope that gave you a bit of a whetting of an appetite in terms of what resources these teams are providing, but there's a few more things that we just want to tell you about in terms of what we're also launching today. We have an online digital portal that went live this morning. It has all of the materials that have been referenced in the presentations thus far. And it's organized in such a way that it doesn't really matter where you are in your caregiving journey. So if you're just starting to build the case in your own organization for this kind of work, you'll find resources there. If you're starting the conversation with caregivers and with staff directly, there's guides and tools there. If you're ready to implement, there's help for you there. And then there's also an evaluation framework if you're looking for some assistance with that too. We've got a bunch of curated lists that are on the site, so you'll be able to just sort of go through that and find resources to suit your own needs. We've also got 2 learning reports based on the Changing Care work to date. This was done with them. One looks at the discovery phase of the work, and the other looks at the actual co-design events.
We've got an e-learning module, so this is specifically directed to staff, to providers who are thinking about doing this work. Each one is an hour. They are accredited if that's important to you. And they are, one is to understand the role of caregivers. It just talks about what caregivers actually do on a day-to-day basis. The second is some tips on how to communicate with caregivers in your work environment. And then the last one is empowering caregivers to do all of the self-advocacy that we've heard about. So as I say, that is all on the Change Foundation website. It's launched this morning, and all of the tools that have been referenced and the badge and all of the great work that's been done, there's lots of information there if you're interested in taking any of this forward in your own organization. So I'm going to stop there now and see if I'm going to ask the presenters please to come up to the table. And then we have a few minutes, I think about 10, we'd love to hear your feedback. If there's anything in particular that sparked your interest. We have roving mics, so if you would like to ask a question or make a comment, please put up your hand and we'll get a microphone to you. And I think the teams would be happy to talk more about the work that they've done, the challenges that they've encountered, and where they sort of see themselves heading in the last year of our supports. So don't be shy, or I'm going to pick on people, and I know your names. So does anybody have anything they would like to ask the teams? And oh, sorry, yes, if you're online and you want to send in a question or a comment, if you use the chat function, we will read that out and get your question answered. Yes, Scott.
Thank you. This isn't for anybody in particular, so just anybody who would like to, thank you, anybody who would like to answer. You're all getting off to a really exciting start and something that's important, and the system has been kind of doing a poor job of until now. So and the start's superb, but what's it going to look like in a couple of years or 5 years or something like that when the processes are mature and you've been able to evaluate what you're doing and where you'd like to go next with this?
No idea if this is on or not. Now it's on. Yep. Okay. If it's all right, I'd like to start, because we've actually talked about this a lot in planning the caregiver model that we've been working on with Bridgepoint. And really our goal is that the client and the patient, as the hospital calls them, and the caregiver feel like when they're in the hospital, for example, that they understand what's going to happen in the community and that the community actually comes into the hospital. So part of the work that's happening is that there is an area being built in Bridgepoint that will be supported, for example, by Wood Green, a community agency, where caregivers can come down and meet others who may be providing the same kind of support, gather support, and also we can run community education sessions within that site so that when you do go home, you are better prepared, you're already connected, and you have a sense of that you're not just falling into some sort of chasm somewhere where no one's ever going to find you. And I think that that's really, really important. And if that is the ultimate goal in this project. And I'll let others speak.
I think it's a great question in terms of sustainability beyond, especially the years where you're funded to actually do some of this work. And so our team has done a great job of positioning back to us as a senior team the need to do that now and start to position it, where is this going to kind of have a home and live in the organization, and how do we leverage our third year to build that is kind of our experience. I'm not sure what we're going to call it yet, but our experience office per se, where we can recruit family caregiver partners as well as patient partners, where we can embed that both in building capacity and leaders about how do you continue to live this and with staff and physically have a place for people to be as well. So we're taking steps right now in terms of how we will continue to live that going forward, so it's ingrained in our culture.
So in Cornwall as well, we really are very mindful that once this funding is going, we need to be ready for that. So part of every project that we are designing from the very beginning, it is we have a co-design model so that we have a caregiver working alongside with a hospital employee. And from the very beginning of every project, we are looking at how is this going to continue when we don't have the funding? So we have established a physical site within our hospital. We're also establishing a website. And the website, it was critical as part of that because it's huge, the amount of information that's contained, for example, on that website. It needs to be very easy to maintain. So there isn't going to be a person there that's going to be able to make sure. So it's a lot of links, and we're trying to keep everything to a minimum. But one of the real focuses that we have too is, in addition, we're training caregivers to be supportive of each other through making sure that they are being provided with the education and training to run their own workshops. We want to develop a caregiver network, so they will run our resource center for us. So it's about providing the support within the organization that will allow our caregivers to continue the excellent work that they already began in our community. We were fortunate to have that, to keep it going. So I think sustainability and spread are key elements of the project design that needs to be considered.
Hi, I can speak for, in Huron-Perth, we have extremely strong partnerships already. Even the primary care family health teams, we meet, the 9 of us, we meet monthly, and we share the same quality improvement decision support specialists. So the spread is the ability to spread is amazing. The team has also done an amazing job to put together ambassador and leader guides. So we're identifying ambassadors at each one of the organizations, and we're putting in orientation as well. So that allows us to, when you get a new employee, you can put them through the orientation and be able to spread this. I'm not sure if you want to add anything else to that.
The other unique thing about the Huron-Perth is our strong partnerships, but we really have been focusing on looking at what spread will look like. And for me, it's the caregivers are going to feel empowered, that there has been already a tremendous amount of word of mouth, which I'm amazed at with such a rural environment. And through some of the support groups that we start, as well as the information our caregivers will receive, they're really going to feel empowered to ask those questions. On the other side of the coin, because we've really done a lot of our co-design work with our providers, is that building the capacity of our providers, that it's just going to be every provider across the entire system is going to know that there is a toolkit, they will use it. I think Dr. Heiss showed very clearly from her practice, it's going to transform. You saw from one of, I'm very proud of one of our nurses. So as soon as they are aware, it's like a light bulb goes off. They have different conversations with their caregivers, and then the ball rolls. So I really see it that we've built capacity for people to have different conversations, and that is going to spread.
And I would just say, from the Change Foundation's perspective, because the same question should be asked of us, I think we really want this to be the new normal. Like, this isn't a special project. It's not somebody has to do a lot of training on it. It's part of the delivery of healthcare. And when we look at whatever changes are coming at us with health system reform, we're going to have to focus very carefully and clearly to make sure that the patient and the caregiver voice does not get lost in moving around the deck chairs. So that's something that we're obviously doing a lot of thinking about. Other questions? Yes, here, James. You need a mic?
Do I need a mic?
Yes.
Probably.
You do. It's just for the people online.
All right. Thank you. This is more an observation on something that you said, Kathy, okay? In the beginning, you talked about the determinants of the caregiver experience being things like geographic location, etc. The one thing you left out was the illness. Mm-hmm. And when it's mental illness, we are, as caregivers, at a much greater disadvantage.
Right.
And that is especially true in rural areas where stigma is a huge contributing factor. Mm-hmm. So it's not a question, it's merely an observation.
Thank you very much. Yep, thank you for that. Krista, you have something from someone online?
Yes, we've got over 200 people online, and the comments and questions are coming in fast and furious. So just a couple of quick comments, just from a comment from someone involved in the Connecting the Dots work, who also heard a lot about privacy and confidentiality, so they're curious to see more about that. And I'm going to put out 2 questions for the panel. Have you had colleagues from other healthcare or home care organization ask you about your work, and what opportunities have you had to spread it beyond your walls? And the second, from Gail, asking if you had one piece of advice to healthcare organizations that want to implement a caregiver partnership program, what would it be?
Want to start?
I'd like to defer this question to Michelle Carter, who is our project lead, because we have had, as a project, a number of questions about this, of, what is it, how can we get it, and we've been challenged with that, and have actually spread a little early. So Michelle, I think you can answer that question quite well. Thank you.
So is this the second part of that question, Krista? Oh, yes. So we've had quite a lot of interest for spread. One piece of advice I would say is really just to always consider where those focused interactions with caregivers are. Is it program specific? So consider how your organization and patient population, how you interact with caregivers, and always value and understand what you're hearing. We heard from a lot of people today that every caregiver perspective is different, and I think our project has really tried at every step to include caregivers as decision makers on our steering committee, through co-design, through our operations. So I would just really encourage you to always consider that voice in every step of your planning, and look at where the most meaningful interactions are going to happen as your starting place, and then plan with your caregivers, as well as your champions who really understand that perspective. So I think that would be it. And we've had a lot of interest on the toolkit in Huron and Perth, and I think it's really because we realized early on that the foundational piece was so important. If we couldn't heighten awareness around the challenges of the caregiver, and then also help providers to understand where our local resources and supports were, we needed something that would work for both caregivers and providers as a starting point. So I think that although it was challenging across a broad area, we knew we needed to have that starting point.
Did other members of the panel have advice?
I'll start off, if that's okay. So I think that it's a great question, and I'm glad that somebody asked it. One of the things that amazed me was just how much interest there was from other agencies about this work. Certainly everyone knows how important it is and the role that caregivers play in achieving success, to be honest, when you're discharging the client or when they're in the community. But knowing how to actually engage caregivers can seem very frightening for a provider. And so, for example, at our Caregiver Summit, one of the things we did was we invited about 20 different agencies, community agencies, to come and listen and to be part of the conversation, and including TC Lynn Home and Community were there. And I think it was a really interesting and robust conversation that that came out of that experience and the different populations and the different services that we provide. So absolutely, there's been a ton of engagement on the hospital side and the community side. And I would just suggest to any agency that's interested is that go for it. You know what? And be ready to make some changes, because when we had our Caregiver Summit Day and they said to me, you know what, you're doing a really crappy job with your respite, as much as it was hard to hear because I thought we were really trying to provide great care, that was great to hear, and it was important to hear and to be able to do something. So if you're going to take it on, be ready for what you hear.
I might just echo that on the answer to the question about getting started. Having the tools and at your hands sure are important, but I would say the most important thing is just to start with heart. Family caregivers will cut you slack if they see you being sincere about wanting to engage them. And if you start there and you're in the right place as a care provider and as an organization, you'll figure the rest out as you go along.
Christine, did you want to add anything?
I think just to say that caregivers have had a seat at the table for a long time in a role more as like, oh, do you have your caregiver or do you have your patient sitting on a committee? I think that this approach is very different, this idea of co-design. It's something that I think that we need to take seriously. We can no longer have the token caregiver. And I think in addition to that, it's important to really listen. And sometimes that's hard for us to do as healthcare administrators. So I think if you go through the effort of doing a discovery phase, if you do your focus groups, your interviews one-on-one, you need to make darn sure that you're actually going to do something with that. So it's about maintaining the integrity of the project and the relationship.
So I'm going to allow one more question. Julie, I think you had your hand up earlier. Did you not? Yeah. Jodine, can you get Julie a mic?
So comment and a question.
Sure.
Is that all right? So the comment is it's great work, really exciting that you're doing, and I've had a chance to chat with Kathy over the past year about the role of caregivers in the healthcare system. I was surprised not to see a lot of emphasis on pediatrics and pediatric moms and dads. I think maybe Bridgepoint mentioned that a bit in their presentation, and just wanted to remark that parents who are caregivers don't recognize themselves as caregivers. We also don't recognize our role as parenting. And I think there's often a default by parents of children with developmental disability and medical complexity that they're simply parenting and that they're meant to be at bedside in hospital 24/7. So I think a look at that and examination of that might be helpful. The question that I had is, senior leaders across the healthcare system, are some of your views and how you might be looking at your patient flow, how you're supporting caregivers in their role from the point of view of transitions, warm handovers, not discharging Friday night at 5 p.m. When there's no home care in place over the weekend, making sure that you're setting up those coordinations between what's needed in the home and home care in terms of supplies and medications and nursing, so that that occurs in a timely way and not 5 to 7 days after discharge. And so how are you looking at that within your organizations as you're tackling this sort of role of caregivers?
At the Huron-Perth Healthcare Alliance and with a number of our partners in Huron and Perth, because we focus on the full continuum of care, not just what we do in the hospital. So with our partners, not in just this project, but in others, we are focusing on transitions of care. It's a large priority for ours. That does help facilitate patient flow, but the emphasis is getting the right information in the right time for successful transitions, not just to help us get people through the system. So we are focusing on patient-oriented discharge summaries with our patient partners. So we have a patient, family, and staff framework where we have, some people call them advisors, we call them partners. And we work with them, and they actually co-design the summaries. They also co-design a number of work that we're doing, the information. So as our Patient Partnership Council, what's got a big hit with them is they are looking at all the signage, like all the things that we put up at the bedside, all the information. So we're really working with our patient partners to advise on what the NPO looks like. Can't have anything by mouth. So that doesn't mean anything to them. So they're actually helping us redesign the information, that we give them information around the hospital, and that's how we're working with them to change that, to help with transitions of care. But I think the patient-oriented discharge summaries being designed with our patient partners is helpful. Because we ran out of time, I didn't have a chance to give one of the quotes. One of our caregivers is a mother of a disabled child, and she said through this project she's felt so empowered that she's not just the mom, she's a true caregiver, and she's really enjoying that empowerment of recognizing that she's not just a mother who's been greatly organized with her family of 4 kids, but this has given her some identity and really helped us move forward. And she's partnered with so many of her other friends who are in the same position as her, and really feels that this is just let us spark. And so that self-care is very important, and identifying their role as a caregiver, not just a parent.
I'd like to say that as a system, to get to where you are talking about having, all of those things in place before people go home, I think we have a ways to go. But I think what this project has done, for us is when we did the co-design project, I don't know if you remember, I held up a checklist. That will tweak the caregiver to ask the questions that he or she needs to ask. 'Cause in there, it's all those things that you listed are as checklists, and then a question can be asked of your care providers. And recognizing that it's not just the nurse that you need to be, or the social worker that you need to be involved with. From the moment you come in, just getting that culture around discharge needs to begin very early on. You know, when you get admitted to the hospital, we need to start thinking fairly quickly about how we can get you safely home so that as a caregiver, you're feeling also very, very supported. But I say we still have work to do. I mean, because what you're talking about are the challenges that our discharge planners deal with on a daily basis. You know, getting home care ready for the day that it's needed. It's always a challenge, but I think that if we begin to recognize and allow people the information and even tweak the thinking around we need to think of these things prior to the 10 minutes before you leave the door.
So I'm just going to comment on this. So thank you so much for raising the point about parents, because I think that's a really important point. And certainly I know at the Sinai Health Systems, their NICU and the work that they've been doing around including parents and ensuring that they're getting the care they need and that they have the information has been amazing work that they've been doing. And certainly in the community, the parent outreach program at Wood Green that is led by parents for parents who have children with developmental disabilities has been huge. And this year, what was very different about that was that normally when the group gets together, they talk about, okay, here's where you can get the resources, here's what you need to know, and they basically, it's a wonderful information sharing model. The difference was they didn't realize or know how to ask for care for themselves. And that idea of self-care was actually quite foreign. And Kathy's right, or you do see yourself as a parent and not as a caregiver. And I think that that's a really important sort of aha moment for the parents. So I do agree with you, and I think it's an excellent point. One of the things that we've started to do at Bridgepoint, and I think it was one of the reasons we chose Bridgepoint as opposed to the Sinai site of the Sinai Health Systems, was that the clients are usually at Bridgepoint a little bit longer, because it's a rehab and complex continuing care institution. And so from the community, we can actually go into Bridgepoint and start to get to know some of the clients. So before they're discharged, our plan is that they already know who their community partners are. Oftentimes, we have an enhanced adult day program. So if the client and the caregiver want the client to come out for the day and see the enhanced adult day program, I can arrange transportation. Even if they're in a wheelchair, that's not a problem. And I can arrange transportation for them to come and spend the day at the Enhanced Adult Day program so they can feel comfortable with the discharge plan. I think that when you're in acute care or in rehab, the idea that you can go home on a dime and everything is set up isn't realistic. And so part of the work that needs to happen is absolutely on the acute care side, there needs to be better planning, but I think on the community side as well, we need to figure out how we can get into the hospitals and really help to build that bridge, so that it is actually a bridge that they're crossing over and that they feel supported throughout the process.
I just wanted to mention about so that's definitely, thanks so much, Ashton, for that. And I just wanted to touch on the neonatal intensive care unit at the Sinai site, because I think the model that they use there is really something that we've learned a lot from. So they have something called FICARE, which is Family Integrated Care. And what's interesting is with that is rather than providing care all the way through and then just at discharge saying, okay, now you're going to need to check blood pressure and you're going to need to check your blood sugar level. FICARE, Family Integrated Care, is having the parent provide as much hands-on care as they're comfortable with right from the beginning. So what they found with that is that parents leave with such a different level of confidence to go home and then be able to provide that support at home, because it's been something they're doing all along. They're reporting in rounds about, how that baby, that very fragile, ill baby, did overnight, and did they require oxygen and, anything like that. So it's just changing. It's really shifting from kind of observing someone provide care to you actually doing the hands-on care yourself, which they found from the studies that they actually spend less time on the unit. They go home sooner because parents feel confident, and also the baby experiences less stress. So I think that that's something for us to learn when providing rehab for adults, is to really involve the caregivers earlier and really do that knowledge sharing and knowledge translation.
I'll only add one thing, because we're focused on several of the things that have already been mentioned in terms of people leaving our organization, but as a rehab and complex care facility, what we heard from family caregivers was, when I was in acute care, I would have liked to upstream know a lot more about what to expect coming to your organization, which is, by the way, just across the street. And so I would put that under the category of work to be done still. We heard that loud and clear about consistency of what providers in acute care know about our organization, how well we've provided information about what to expect, and then how do we help family caregivers further upstream to prepare to come see us.
So it's actually after 6, so I think we should probably draw a close to the formal part of this evening, but if you can stay, please join us for a little reception next door, and let's give these guys a great round of applause.